further to go. Of course, our goal should be to cut that number in half again, and I believe we can do it. In fact, I believe the potential to enhance children's well-being goes even beyond mere survival. We can get rid of this disease, polio, that historically paralyzed hundreds of thousands of children every year. Protecting children's health seldom stems from a single innovation. It typically requires the synergy of a number of tools and collective work. And we know when it comes to delivering better outcomes for children, eradicating polio is going to be critical, not only because it saves lives and prevents misery, but because it imagines a world where we can be free of all diseases, and it shows the power of partnership in coming together to make that happen. It was 1988 when the Global Polio Eradication Initiative started. Thanks to the hard work of partners like Rotary, health workers, and disease surveillance officers, wild polio cases have fallen by over 99%. Over 20 million kids have been spared being paralyzed by this virus. Today, wild polio is endemic, that is, has never been eliminated in just 2 countries, Pakistan and Afghanistan. I've had a chance to visit the operations centers in Islamabad and learn about the hundreds and thousands of workers who are working to protect children. Every day, polio workers and volunteers pour over data and perform outreach to communities to get the polio vaccine to every child. These workers are tireless, and because of them, only 2 cases of wild polio have been recorded in Pakistan and 2 in Afghanistan so far this year. The world is very close to eradicating one of the most preventable threats humanity has ever faced. But it's not done until we get to 0. It can spread back to where it was before. So we can't afford to slow down, or we'll risk unraveling decades of progress. We have the tools, we have the strategies, and now we need the partnerships and the vision. Fortunately, this is coming together. In fact, today is a totally critical day in making this happen. I want to thank the Kingdom of Saudi Arabia, His Royal Highness Mohammed bin Salman, His Excellencies Dr. Al-Rabi'a, and His Excellency Al-Jalalja for their generous contribution today. They are working with us to make this dream a reality. The new commitment will deliver vaccines, measles immunizations, and other health services to 370 million children. It's an investment in the future of children around the globe and in strengthening health systems. We saw over the last 4 years how important primary health care is. It was really these systems that allowed us to limit the spread of COVID. And these investments are paying dividends for many diseases. That's why it's so encouraging to see not only Saudi Arabia, but many other countries, including the United Arab Emirates, come together to increase their support for global health. The Lives and Livelihood Fund, managed by the Islamic Development Bank, is a fantastic example of this. It's a very well-run program that lifts people out of poverty across the more than 30 member countries of the bank. So it's inspiring to see the region, with leadership from the Kingdom of Saudi Arabia, at this pivotal moment, addressing tough challenges. Throughout this forum, we've heard how global collaboration is the key. I look forward to our new partnership with the Kingdom of Saudi Arabia, collaborating not just to end polio, but to ensure a safe and healthy Hajj pilgrimage, to build new vaccine capacity, to better respond to urgent humanitarian crises, and fortify the world against future pandemics. We know that losing 4.9 million children each year is about a lot more than just a number. It's about millions of kids not reaching their full potential. It's also the ripple effect that better health for more people kicks off. Less poverty, improved education, and resilient economies. The stakes are very high, so I want to thank everyone who's stepping up to this historic opportunity. Thank you for building on the progress we've made, and thank you for your commitment to realizing a better future. Thank you.
Bill Gates and Dr. Ajal and His Excellency Dr. Al-Rabiya, thank you both. Thank you all very much. And now I want to invite the Prime Minister of Pakistan and the Director General of the WHO and the President of Gender Equality at the Bill and Melinda Gates Foundation to come back to the stage for photographs. Thank you very much, everybody.